Hello, my name is Dr. Forsch, Chief Academic Officer, and I'm speaking to you today to welcome you to a new course created by Doctors Hospital at Renaissance Healthcare System. The development of this course was made possible in part by an award of a Skills Development Grant Fund to DHR Healthcare System and South Texas College, partners with the Texas Workforce Commission. This award has allowed DHR Health System to expand and revitalize our existing training, as well as create entirely new training and development courses for you, our employees. I strongly believe that cutting-edge education and training programs will not only further DHR's mission to empower the caregivers to heal through compassion, knowledge, innovation, integrated care, and excellence, but also keep you, our employees, among the most highly skilled and competitive healthcare professionals in the state. As we continue to grow as a community and as a health system, the importance of continuing education for our employees cannot be understated. As we gain high acuity units and procedural areas, we need you, our employees, to gain the skills necessary to advance into those areas, and we will do everything we can to support you in this endeavor. I am proud to say that our educational staff at DHR Health System is continuing to work hard over the upcoming year to bring you new and innovative training programs to advance your skill sets and to help you keep a competitive edge in the labor market. Thank you for participating in today's training. Thank you for sharing DHR's mission to improve the well-being of those we serve, every patient, every encounter, every time, and thank you for making the Renaissance difference.
Hi, my name is Dr. Carlos Cardenas, and I am the Chief Administrative Officer here at Doctors Hospital Renaissance Health System. In this module, we will review concepts related to professionalism in interactions with guests. When our employees project a strong sense of professionalism, it sends a message to patients and guests that they will be well cared for by our knowledgeable staff. This lays the groundwork for a trusting relationship between patient and caregiver, which in turn leads to better communication, better care, and better patient outcomes. During this training, you will describe proper introductions and greetings, describe inappropriate behaviors, recognize the importance of being knowledgeable of job duties, policies, protocols, and procedures, model ideal interactions with patients and guests, and apply AIDET principles to deliver a consistent experience to every patient, every encounter, every time. Research has shown that when the patient has a positive patient experience and are engaged in their care, they are more likely to be compliant and are less likely to be readmitted. By setting the standard with outstanding customer service, you will be helping to engage patients in their care and in improving patient outcomes.
Good morning. Welcome to Doctors Hospital at Renaissance. How can I help you?
Hi, my name is Anthony Sebastian, and I have an appointment at 10 o'clock.
Sure, let me check you in. All right, you're all set. Go ahead and have a seat and we'll be with you soon.
Awesome, thank you.
You're welcome.
Hey, how much longer do I have?
Sir, I don't know.
Listen, my appointment was at 10 o'clock. They told me to be here at 9:45 and it is 11:15 now. I mean, I've been here forever.
Well, technically, it's only been an hour and 15 minutes.
An hour is a long time. And listen, if you're not going to keep your appointments, why make them anyway?
Because that's what they tell us to do.
Unbelievable. I have to get to work. So tell me really, how much longer is it going to take?
You are just going to have to sit down and wait like everybody else.
It is important that as caregivers, we are sensitive to the impression that we give our patients regarding their care. Patients react negatively to caregivers who do not seem knowledgeable about their treatment or who do not deliver consistent care. A patient who feels anxious, fearful, confused, or helpless regarding their care may react by becoming demanding, angry, distrustful, and less compliant. Your attitude and habits as a professional can greatly impact your patient's perception and therefore their outcomes. This begins with a good first impression when approaching and greeting the patient. Always greet your patients warmly and with a smile. Introduce yourself and your role and explain what you are doing. Dress professionally. Keep your scrubs neat and wrinkle-free, your hair managed and out of the way, and maintain good standards of grooming and hygiene. When greeting patients, address them by their name and always use 2 patient identifiers to verify. When leaving a room, always smile, thank the patient for allowing you to treat them, and ask, "Is there anything else I can do for you? I have time." Let's examine these ideas by first watching what not to do when seeing a patient.
Miss Garcia, I have a medication for you.
Excuse me, but I'm not Miss Garcia.
Oh, what's your last name?
Morin.
Okay, let me change it here. Okay, here, your doctor prescribed a medication.
What is it for?
I have no clue, but I'm sure it'll do you good. I'll try to find out for you later. Just take it.
Okay.
The nurse in this video does a number of things that make the patient fearful, and for good reason. Many of these are dangerous mistakes. First, she does not greet her patient warmly, nor does she properly identify her patient. She even goes as far as to change her name in the record when the patient corrects her. Next, she does not tell her patient what drug she is administering or what it is meant to treat. This is a highly inappropriate and potentially life-threatening practice. The nurse gives an overall impression that she is unconcerned about the patient's treatment and is not knowledgeable about the treatment plan, which makes the patient visibly anxious. Lastly, the nurse exits the room without letting the patient know she's done, without thanking her, or checking whether there is anything else the patient may need. Let's see what an appropriate version of this interaction looks like.
Miss Morin? Hi, good morning, Miss Morin. I'm Angela. I'm going to be your nurse today. How are you doing?
Good.
Great. I have a medication for you, Miss Morin, this morning. Can I please see your arm so I can scan you? Thank you very much. Miss Morin, what I have for you this morning is called Lasix. It's a medication that we give for water retention, so it might make you go to the restroom a little bit more than often. Don't get concerned, that's what the medication is for, and it may cause a little bit of dizziness. Of course, if you experience any dizziness and you need help, please let us know and we'll be here for you to help you. Just press the red button. Can I assist you with anything else, Miss Morin?
No, thank you.
Thank you, Miss Morin. It was a pleasure.
In this video, the nurse makes a good first impression, shows caring, compassion, and a professional and knowledgeable demeanor. First, she greets her patient warmly. She introduces herself, her role, and lets the patient know why she is there. Next, she verifies the patient's identity using the barcode on her wristband. The nurse tells the patient what the medication is, explains why she's getting it, and lists possible side effects. Before she exits the room, the nurse asks the patient if there's anything else she needs and thanks her. In this example, our nurse took the time to manage the patient's emotional response to her care by providing a warm, courteous, and respectful demeanor. The patient in this video is much more likely to respond positively to continued treatment. Nurses and clinicians often use an acronym called AIDET, A-I-D-E-T, to help organize and deliver clear and effective communication to patients, and many of these principles of communication are universal in interactions in the healthcare setting. You may think that there is no time for AIDET given increasing complexity of patients and higher volume, but incorporating AIDET can actually save time and improve patient outcomes by ensuring that patients are well informed and understand their plan of care. AIDET stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. Acknowledge and introduce demonstrate care and concern for the patient. Acknowledge the patient's right to privacy and control over their care by knocking and requesting permission before entering the room. Introducing yourself to the patient, including your role and why you're there, will help the patient understand their plan of care and your role in it. Duration and explanation communicate the pertinent medical information to the patient. Provide the patient with a reasonable expectation of the duration of the procedure or your visit with them, as well as follow-up times. This shows the patient you respect their time and sets their expectations, decreasing anxiety. Remember to under-promise and over-deliver on time commitments. Explain the procedure or medication being delivered to the patient. Verify this is the correct treatment plan for the patient and demonstrate that you are knowledgeable about the care that they are receiving. Thank the patient for their cooperation and ask if there is anything else you can do for them. This concludes the visit with a demonstration of gratitude and a desire to help and furthers the culture of hospitality of the facility. While it is important that all components of ADET be incorporated into your visit, they do not need to be strictly scripted or in order every single time. Let's watch an example of what ADET looks like in action. See if you can identify all 5 components.
Good morning, Mrs. Jones.
Good morning. How are you?
My name is Jessica, and I'm going to be your nurse today.
Oh, okay.
How are you today?
Well, I've got this pain that just won't go away.
Oh, I'm so sorry. I do have your morning medications, and I'm going to give you a pain pill. Okay? And I also have your lisinopril for your blood pressure. Okay?
Okay, good.
I'm going to need your armband to scan your bracelet.
Sure.
Can I have your name and date of birth, please?
Sylvia Jones, 3358.
And then you are going to get a Vicodin for your pain. It may cause some dizziness. So if you need any help, you need to call us. Okay. And I'm going to put your call light right here. Okay. So you can call us if you need any help. And I'm going to put your phone close by as well.
Okay, thank you, honey.
So it's going to be your Vicodin for pain and your lisinopril for your blood pressure. And here's some water for you. Is there anything else I can assist you with? I have time.
No, that's okay, honey. Thank you. I'm just going to take a rest now.
Okay, and we'll be making rounds in about an hour. If you need anything in the meantime, just give us a call.
Okay.
If not, I'll come in an hour to see you, okay?
Thank you so much.
Thank you.
Good morning. Welcome to Doctor's Hospital at Renaissance. How can I help you?
Hi, my name is Anthony Sebastian, and I have an appointment at 10 o'clock.
Sure, let me check you in. All right, you're all set. Go ahead and have a seat, and we'll be with you soon.
Awesome, thank you.
You're welcome. Yes, sir.
Hey, how much longer is it going to take?
Sir, I apologize for the delay. We will see you as soon as possible.
Listen, my appointment was at 10. They told me to be here at 9:45, and it's 11:15 now. I've just been here forever.
I'm so sorry for the wait. Let me see if I can get a time frame for you.
Okay.
Hi, Amber, it's Mary. Do we have a time frame for Mr. Sebastian? Okay, great. Thank you. The doctor is in with another patient right now, but we should be able to call you back in the next 10 minutes. Would you like a magazine while you wait?
No, I'm okay.
Well, I apologize again. Your healthcare is very important to us.